Homeopathic Medication Part 9. Homeopaths claim that they can determine the properties of their preparations by following a method which they call proving. As performed by Hahnemann, the provings involved administering various preparations to healthy volunteers. The volunteers were then observed, often for months at a time. They were made to keep extensive journals detailing all of their symptoms at a specific times throughout the day. They were forbidden from consuming coffee, tea, spices, wine, spices or wine for the duration of the experiment. Playing chess was also prohibited because Hahnemann considered it to be too exciting. Though they were allowed to drink beer and encouraged to exercise in moderation. At first, Hahnemann used undiluted doses for provings, but he later advocated provings with preparation at a 300 uh, with a preparation at 30 C dilution. And most modern provings are carried out using ultra dilute preparations. Provings are claimed to have been important in the development of the clinical trial due to their early use of the simple control groups, systematic and quantitative procedures, and some of the first applications of statistics in medicines. The lengthy records of cell experimentation by homeopaths have occasionally proven useful in the development of modern drugs. For example, evidence that nitroglycerin might be useful as a treatment for angina was discovered by looking through homeopathic provings. Though homeopaths themselves never used it for that purpose at that time, the first recorded provings were published by homeopaths Hahnemann in his 1796 essay on a new principle, combined the result of 27 provings, and his 1810 Materialia Medica Pura contained 65. For James Taylor Kent's 1905 lecture on homeopathic Materia Medica 217 preparations. Though the proving process has superficial similarities with clinical trials, it is fundamentally different in that process, which is subjective, not blinded. And modern provings are unlikely to use pharmacological active levels of the subject under proving. As early as 1842, Oliver Holmes had noted that provings were impossibly vague and the purported effect was not repeatable among different subjects. Evidence and efficacy. Outside the alternative medicine, community scientists have long considered homeopathy as a means of treating the disease. But some of them have started calling it a sham, a pseudoscience, and the medical community regards it as quackery. There is an overall absence of sound statistical evidence of therapeutic efficacy, which is consistent with the lack of biological plausibilities with any biologically plausible and which is consistent with the lack of any biological plausible pharmacological agent or mechanism. Proponents argue that homeopathic medicines must work by some as yet undefined biophysical mechanism. No homeopathic preparation has been shown to be different from the placebo.